Hello everyone. Postcoital tristesse is a depressive feeling that anyone can experience after having sex. Some people say that it includes man's feeling of loss that lasts only for a short time right after ejaculation. And others argue that the feeling should be overwhelming and strong enough to make one cry or develop hatred against the sex partner and oneself to meet the criteria for postcoital tristesse. Both cases can be included in postcoital tristesse, but its operation is different for men and women. Let's first look at men's postcoital tristesse. As men develop sexual desire, zest ones are generated based on zest information that is perceived in zest mind, and negative zest energy is generated. Negative zest energy is delivered to man's body and mind, and the pleasure of the same level of negative zest energy is sensed in man's conscious. Men may maintain a certain level of pleasurable sensation in the process of masturbation and having sex with a partner, and feel a strong pleasurable sensation at the moment of ejaculation. Men who cannot generate positive zest energy always activate negative zest energy, so they activate negative zest energy and even at the moment of ejaculation. They just cannot recognize it since it is covered with a pleasurable sensation recognized in the conscious. Then the pleasurable sensation ends right after ejaculation, and negative zest energy is recognized as stress with the same value of pleasurable sensation. Then how is postcoital tristesse different for women? Women's postcoital tristesse is not a temporary sensation that men feel after ejaculation, but a continuous feeling of depression. Women feel deeper and stronger negative feelings. Ones of my mind is at work instead of zest ones in zest mind in women. Women do not activate negative zest energy based on zest ones as men do. Women's ones in my mind is activated to generate negative zest energy. Women who have many ones in memory feel more depressive feelings after having sex. They may feel like crying or actually cry and retrieve feelings of hating self and others. Women's wounds activate the operation of zest energy to restore happiness, which is manifested as women's sexual desire. Women's sexual desire is not the desire for pleasure, but the desire for wound treatment. Not many women understand that they can treat wounds in my mind through activating zest mind. They rather try to depend on other people who can make them feel happy, which only aggravate their condition and raise the level of dependency. Then they seek having sex as a means to satisfy the desire for love and happiness and keep losing their energy in my mind and generating negative zest energy in zest mind. Ironically, these women feel greater level of sexual pleasure based on the greater level of wounds in my mind. But they recognize the deep depressive feelings after having sex without knowing the reason. They may enter the vicious cycle of seeking sexual pleasure, feeling more and more depressed after having sex, and developing greater level of sexual desire and dependency for love and happiness. There can be two ways to solve the problem of postcoital tristesse. One is to completely destroy one's mind and live only for sexual pleasure, which makes both men and women unable to recognize pain in mind. People with serious psychological disorders may not feel depressed after having sex since their mind has stopped functioning in a normal way. Another way is to learn how to generate positive zest energy. Men can enjoy the highest level of sexual pleasure without sexual desire and use zest energy for generating passion. Another way is to learn how to generate positive zest energy. Men can enjoy the highest level of sexual pleasure without sexual desire and use this energy for generating passion for pursuing values of life. They have most powerful sex ability and don't have to experience postcoital tristesse at all. Women can activate sexuality in the way they can generate love and happiness. They should learn about the concepts accurately and internalize them to practice in daily life.